What does it say to you when we see these high numbers in a population that's so young, they're starting so early?
That is the concern, right? Because many of these kids, Health Canada says 1 out of 2 people who start smoking will become lifelong addicts. That's the concern. They start young, the tobacco industry hooks them young, and they stay addicted. And it leads to many health problems, and it burdens our healthcare system, it costs lives, it's the #1 preventable cause of sickness and death, and in a province where we're trying to grapple with rising healthcare costs, why are we not taking this problem more seriously? 1/3 of cancer deaths are attributable to tobacco use, and unless we get a hold of these numbers and prevent kids from starting and get these kids who are smoking now to stop, we're going to have big problems in the future.
Talk a bit about what you would like to see being done here in the province.
Well, one thing I want to credit the government for, a really important measure, is the smoke-free public housing policy. That's huge. That affects kids, that affects families, vulnerable groups. So we applaud the government for that bold move. But there are a number of other measures we've been advocating for years. For example, banning all flavored tobacco products, which most provinces have done. In Saskatchewan here, for example, we have a high rate of use of smokeless tobacco, which come in all kinds of tantalizing flavors for kids. Why are we allowing this when most provinces are addressing flavors? We could be raising tobacco taxes more. We know that that is the single most important thing governments can do, most effective measure governments can take to reduce tobacco use. We want to work with the provincial government to put these measures in place. Most other provinces have adopted these measures. These are not cutting edge any longer.